I had physical therapy yesterday, and I did things with my body that I couldn't do a month ago or 2 months ago or 6 months ago. I'm doing full planks now. You guys know what planks are? Yes. Okay, with a bad back, and I'm just excited. I'm excited to move forward. It's been a year. One day I woke up with a little pain, and it got worse as time went on, and I stopped bending and I stopped lifting, and now I'm doing all that stuff again. Mark Warren, I had an L4, L5 lumbar fusion. Center State Hospital in Freehold, New Jersey. Well, it started off about 6 or 7 months prior to surgery. I was getting some hip pain, left hip pain, and I didn't know where it was coming from, and I lived with it for a while, and then I went to see a specialist, and that specialist recommended getting injections. So I went through a series of actually 4 injections, which 2 or 3 of them did nothing. One of them helped me for about a 24-hour period, and that was it. And after following up with that specialist, I told him that the pain is getting worse as time goes on. But during this process, I was also going through physical therapy. And I had about 16 sessions of physical therapy, and I approached the head of the physical therapy and said, hey, this is not helping. I'm going home. I'm in agony every day. This isn't working. And it was not back pain. It was shooting pain, which was going to my hip and down my leg. My leg was basically numb and really just dead. It was terrible. It was pain at the hip and nothing between the hip and the knee, but the knee to the toes, I couldn't feel, I couldn't walk. It was like it wasn't there. It was really, really painful. Well, the pain was sometimes excruciating, where I'd take a step and fall on the floor. Other times I'd get up at night to use the restroom and needed help to get there because I couldn't put any pressure on my lower leg because the pain that was shooting was unbearable. And yeah, it was really, really tough. It was a tough, tough time. I was miserable. I drove some. I was skeptical to drive, although sitting was a better position than standing, so that helped a little bit with the driving. I was able to work remotely at that time. Pre-COVID, there was remote work, and I had a home office, so I was able to do some work from home, but I wasn't very productive because I was balancing the pain. He was a pain management doctor. And again, we went through 4 series of injections, and it just didn't help. It just didn't help at all. And in physical therapy, it got to a point where that wasn't helping me either. And I spoke to the head of the physical therapy group, and I sat him down and I said, hey, this isn't working. He said, I know, Mark, I don't think there's anything else I could do for you here. I was referred to Dr. Goldberg by the director of physical therapy, where I was going for about 5 or 6 months for physical therapy sessions. Well, I met with Dr. Goldberg on the referral, and we discussed my symptoms. He physically examined me, had me do some walking tests, recommended I get an MRI. After those results came back, I met with Dr. Goldberg, and he told me his findings and his recommendations on what needs to be done. And I was a little scared, and I wanted to digest that and educate myself because I'm an internet person. So I read a whole bunch of stuff, and I felt confidence in what he was saying, and I just couldn't take the pain anymore. The pain was excruciating at times. But what it was is normally they do 2 4-inch incisions parallel to each other, and in this procedure what they did is they did 1 4-inch incision on my left side, and on my back, which is equal to the level with the spine, they made 2 like pencil holes. And what that did, how the doctor explained it to me, instead of having 2 parallel lines where you have to go in at the same angle, by having one on the side and these 2 other holes, he has more flexibility to get to where he needs to go because he's coming in from 2 different angles. Plus, you're not getting a second 4-inch incision. It was crazy. It was crazy what he did. And those two little small incisions healed so quick. When I came out of it, the pain was crazy. It was nuts. Luckily, I had a drip that I was controlling, which helped. I didn't want to use it because I don't like using pain meds, but they said, don't be stupid, use it, you know, take the edge off. So I did, but it was a couple days, and you know, in and out, and people turning me over because I couldn't do it on my own. But after a couple days, they needed to get me out of bed. And they made me try to stand up, which I couldn't do without help. And the first time when physical therapy came to the hospital, into my room, I was able to take one step. But you know, after another day, I was walking in the hallway, and they worked with me a couple times a day, and I knew I was on my road to recovery. But the most amazing thing out of this whole thing, no leg pain ever again. That was it. I haven't had it since. Center State, the team was over the top. They really took great care of me, and it was during COVID. So, you know, I had my own room, which was great. My nurse team was always on top of their game, full time. It was great. They really did a great job. Dr. Goldberg was great. He was attentive to seeing me. He came in at least once a day to see me, and, you know, addressed any questions, helped me get anything I might need. It's been a long haul, from getting from my home to my first post-op physical therapy session. Wasn't easy. Seeing results made me more optimistic about the final result, you know, the final goal. And I've been going to physical therapy 3 days a week, every week for 3-4 months right now. And I feel great. I spoke to Dr. Goldberg last week, and he gave me clearance for full lower back movement, so I can get back on the golf course this year, which I wasn't sure I was going to be able to do, so I'm very excited. Anybody who's having similar symptoms, make sure you go see a professional. Dr. Goldberg was great. He addressed every problem I had, and look at me now. I'm here talking to you about quick recovery. But it's slow and steady, and you have to be patient. It's major surgery.